بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Hello everybody. Uh, in the previous lecture, as you know, we provided an overview of subdisciplines of health informatics, and we have described and compared different subspecialties of health informatics, such as clinical informatics, imaging informatics, bioinformatics, public health informatics, and nursing informatics, and its significant roles in improving healthcare quality and patient safety. However, in our current lecture for today, we are going to talk about the medical information systems. We are going to describe the medical information system areas of applications and identifying the different subspecialties of medical information systems, such as clinical information system, nursing information system, radiology information system, order entry system, laboratory systems, pharmacy systems, and we are going to identify the difference between all of these subspecialties of medical information system. Okay, so our learning objectives for today's lecture is by the end of this lecture, the students will be able to describe the medical information systems, areas of application, and he also would be able to identify the different subspecialties of medical information systems. Medical information systems. So what's the medical information system? The medical information system is a general-purpose computer-based information storage, retrieval, and analysis system. It's designed for time-sharing, online computer system for the rapid and easy creation, maintenance, and analysis of general data files. A wide variety of type of information may be used. These include numeric, categoric, text, date, and multiple response. The file structures allow several sets of data, including date-oriented data, to be used. Medical information systems permits a study to be created, a description of data made, data to be entered and updated into records, and for the data to be displayed or analyzed by the investigator without program intervention. Sorry. Now we are going to talk about the historical movement of medical information systems, the development of medical information systems. So, by the late of 1960s, mainframe-based hospital information system had been developed that could integrate patient data in a single database. In the 1917s, many computers made it possible to link the subsystem database for clinical subspecialties and uh, ancillary services to the mainframe and integrate patient data into patient record records stored there. Also, in the 1980s, the microcomputer-based systems that have had evolved independently for specialized services became subsystems of larger medical information system with an integrating central database management system. So storage grew cheaper, registers became databases, and databases became data warehouses, and secondary clinical databases were developed. The recognition that databases were equally as important for querying and retrieving data as for documenting care led to addressing issues of terminologies and other data standards. Uh, so these data, or the fact that that much data was unstructured, led to the development of natural language processing for retrieving and understanding unstructured data. And the unstructured data will be explained more, I think, in the next lecture in the big data topic. We are going to talk about the rule of or the benefits of analyzing big data and how to understand the unstructured data. In the 1990s, patient care data expanded in volume and complexity, and innovative clinical information systems offered hospitals and clinics new capabilities. From the 1990s on, the impact of Internet and the web grew, enabling global exchange of clinical data and medical knowledge. While in the 2000s, distributed information systems allowed physicians using clinical workstations to enter orders and retrieve test results across multiple medical center databases. In 2010, federal support greatly increased the use of computer-based patient records, and a global wireless communication cloud storage for translation networks evolved that linked data warehouse in collaborating medical centers nationally and offered the mobile e-health care for individual patients. Now, we are going to talk about the medical information system subdivision or subspecialties or disciplines. An example of medical information systems, we have a clinical information system, nursing information system, radiology information system, and order entry system, laboratory system, pharmacy system, and there's other systems, but these are the most important systems that we are going to focus on. And these systems, the combination of these systems that coined the electronic health records according to I mean at the nationwide or uh, at the level of the whole country. Okay, so these systems are the main component of electronic health records. So each of these systems we are going to explore it more in the next slide. So the first one is a clinical information system. Uh, Clinical information system is one of the components of health electronic record. So the healthcare industry is underperforming despite having a record in spending, and major concern have been raised due to the wide range of clinical errors. So the cost of these errors is mounting expenses from compensatory therapies, readmissions, and unnecessary tests. For example, clinical errors in the United States cost about $19.5 billion in 2008, of which $17 billion were directly associated with added medical costs such as ancillary services, prescription drug services, and inpatient and outpatient care. And moreover, in the United States, more than 250,000 deaths per year have been attributed to medical errors, which has become the third leading cause of death after heart disease and cancer. So the clinical information system are crucial to delivering the best in evidence-based and patient-centered care. And the clinical information system has great potential in reducing medical errors and increasing legibility, cutting unnecessary healthcare costs, and boosting the quality of healthcare. Okay. So what's the clinical information system? Clinical information system are defined as a computer support application with relatively large and long-term database containing clinical data that are used to assist in the management of patient care. Okay. Clinical information systems are computer systems that provided immediate access to current patient data regarding clinical notes, medication history, laboratory reports, images, and report either directly or via data network. They are part of a hospital information system which facilitates direct patient care. The effective clinical information systems has a significant role in cost reduction, workflow improvement, and standardization of procedures. The clinical information system consists of a wide range of network technology, clinical database, electronic medical records, as well as other clinical informatics research evidence systems. Okay. The healthcare delivery system is changing in many ways. Technological advances are providing opportunities to optimize the patient care with healthcare quality. As you can see, the figure of infrastructure, as you can see in the slide, the figure of infrastructure and flows in clinical information systems provides a generic model of information flows among clinical information systems. Information from various clinical information systems is entered into an electronic health record. This information is then networked to different databases as needed. Clinical information from electronic health records and different other systems is then exchanged for proper and effective treatment. For example, it may be used for effective decision making. A clinical information system is widely seen as a rapidly and offering unique opportunities as well as challenges never experienced before. So both opportunities and challenges cut through technological, organizational, and human factors. However, the interaction between these factors is responsible for providing a more informative and richer lens for understanding the current and the future landscape of clinical information systems. Okay? Okay. The rule of clinical information system. The major rule of clinical information system is to capture, store, process, and timely transfer information to clinical decision makers for a correct and rapid decision. For example, clinical information systems can easily import data from different instruments such as vital signs monitors, ventilators, and infusion devices, store them safely, and display them in specific tables and formats. One advantage of this type of system is to interconnect with other subsystems in the hospital. For example, pharmacy, different laboratories, radiology, and different image processing storage solutions. For example, a physician can remotely, directly, and timely access a patient medical history supported by, for example, automatic sorting or summarization of clinical data. By examining a patient's medical history in the context of relevant clinical research, physicians can take informed and evidence-based decisions. Okay. An optimal integration with other relevant systems in the health information systems ensures that a clinical information systems enhances communication among physicians, radiologists, pathologists, nurses, and other healthcare staff. And accordingly, this could lead to better clinical workflows, decision making, and reduction in the adverse event, and ultimately the improvement of the overall quality of care and patient safety. The clinical information systems have the potential to address many problems encountered in healthcare, namely as managing large amounts of patient and research data, reduce healthcare costs and errors, increase legibility, and boost the quality of healthcare and patient safety. Similarly, a study conducted by Islam et al. 2018 found that the clinical information system clearly offers significant improvement to patient care. They are important tools in primary care of recording and managing patients' information in an efficient manner. They also support the organization of patients' demographic and clinical data, data storage, and manipulation ensure overall care of the patients. In addition, managing clinical information through clinical information systems helps to reduce prescription errors, unnecessary testing, and hospitalization. Clinical information systems can support the meaningful and effective treatment of patients and could improve safety, productivity, and healthcare outcomes. Uh, Accordingly, a good clinical information systems contributes positively to patient safety, workflow efficiency, and to point-of-care decision support. The development of clinical information systems has posed some new challenges and at the same time has also generated new opportunities. For example, by multi-directional interfaces among clinical information systems enable a seamless flow of information from test exam ordering to result presentation and therefore facilitate faster test turnaround times resulting in in a quicker diagnosis of patients. Clinical information systems may also reduce the test and medication errors through dose adjustment, dose range checking, therapeutic duplication checks, uh, formulary alerts, drug allergy, uh, drug laboratory interaction checks, and unnecessary test reminders. Uh, in the next slide, this table shows major opportunities for clinical information system. So, for example, it's improved quality and optimize the use of resources throughout the health systems, and it enhanced communication among physicians, radiologists, pathologists, nurses, and other healthcare staff, as we mentioned before. So all what we mentioned before, we have gathered together in this table. It also improved data quality and the analysis of patient data by combining it with the physician's own knowledge. And it is a development of better and more effective security protocols. Development faster test turnaround times to provide quicker diagnosis for patients. So the adaptation of information technology in healthcare has been particularly slow and lagging behind as compared to other domains. This is due to the complexity in issues like interoperability, technological rationality, acceptability, managerial rationality, data security, data quality, and standards. In general, one can observe poor or even absent support for the exchange of patient-related information within the healthcare system, preventing immediate access to up-to-date and complete patient information. And in Table 2, major challenges of clinical information system are given, such as development and integration amongst subsystems, and other major challenge of clinical information system is interaction between administrative staff and physicians. Other challenges, different data models among different vendors and sites. Other challenge of clinical information systems is medical rationality, software maturity, security, and privacy considered from the challenge, and the technical implication and data quality, and the direct and indirect cost because of high initial investment and low perceived return on investment. Okay. So, computerized provider order entry system is the second health information systems that we are going to describe in this lecture and explore. The computerized provider order entry system (CPOE) has revolutionized the way physicians and other providers direct patient care in multiple settings. Computerized provider order entry systems are essential components of ambulatory and inpatient clinical information systems. Why it's essential components? Because it allows a physician to prescribe electronically, communicate with various departments such as pharmacy, laboratory, radiology, intensive care unit, and also alert physicians on potential drug or drug allergy interaction. Okay, so what is the computerized provider order entry system? So what is the computerized provider order entry? It's an application that allows healthcare providers to use a computer to directly enter medical orders electronically in inpatient and ambulatory settings, replacing the more traditional order methods of paper, verbal, telephone, and fax. So it's a movement from using traditional order methods of paper, verbal, telephone, and fax to use an electronic approach, the computer-based, to directly enter medical orders in inpatient and ambulatory settings. So the computerized provider order entry systems can allow providers to electronically enter medication orders as well as laboratory, admission, radiology, referral, and procedures orders. So strictly defined, the computerized provider order entry systems is the process by which providers directly enter medical orders into a computer application. Okay. While computerized provider order entry system on its own has an impact on safety by ensuring legible orders, it's the addition of clinical decision support systems that drives the value of this functionality. This key component gives providers real-time support on a range of diagnoses and treatment-related information, as well as tools aimed at improving patient care and reducing medical errors and costs. In addition, decision support may add rules to check of drug-to-drug interaction, allergies, medication contraindications, and renal and weight-based dosing. Okay. So the computerized provider order entry systems with the clinical decision support system play significant role in improving medication safety and quality of care, as well as compliance with guidelines and the efficiency of hospital workflow, that they can also reduce the cost of care. Okay. Computerized provider order entry system has been shown to reduce the number of medication errors in hospitalized patients. It, however, has not been shown to reduce mortality significantly. It is associated with increased time of completion of some physician workflow. Other advantages of computerized provider order entry systems include point-of-care clinical decision support and improved patient safety through built-in medication interaction checks. Uh, so the function of computerized provider order entry. So, sorry. The most significant function of computerized provider order entry system is to make it easy for the provider to do the correct thing for the patient and difficult to do the wrong thing for the patient. Many safeguards are available in most computerized provider order entry system. These include checks on drug-to-drug interaction, drug-to-disease interaction. For example, alerts when ordering a blood thinner in a patient with an active diagnosis of upper gastrointestinal GI fleet, for instance. Drug age. This list is included to assist providers when ordering medication for the geriatric population or with the pediatric patients. Many dosages are different. Other system in this lecture is the nursing information systems. So in recent years, there has been a rapid increase in the number of studies conducted in the fields of education and application concerning nursing informatics worldwide. These studies have determined that the use of health information system has increased the communication between healthcare professionals, developed multidisciplinary coordination, and decreased stationary works. As nursing information system allows recording and storing patient data, it provides a data source of the statistical evaluation and investigations of healthcare professionals. Okay? As we know, nurses spend a lot of time for filling in various documents not related to patient care. So the nursing informatics allows nurses to act more quickly in synthesizing the nursing knowledge that affects patient care and developing knowledge in nursing. Thus, it also makes important contribution to occupational professionalism by enhancing the nursing care quality and patient safety. The need for nurses to develop skills in handling information, deciding what information they need to collect to do their jobs, how to analyze it, present written reports well supported by both quantifiable and qualitative data is now well recognized. Computer technology is a reality of our modern world. It gives us a tool which can be used to help us with the complexity and efficiency which is often required in many areas of work. The nursing profession is at last beginning to appreciate the role which the new technology can have in improving the services provided to patients. Uh, Only by taking an active role now in the implementation of computers to clinical practice can nurses maintain control for their own professional contribution to the large complex system at present being implemented in many healthcare settings. Knowledge-based systems are set to become a major component in the nurse's ability to take on this role. Sorry. Recent attention has focused on the procurement and implementation of nursing information system within the acute sector. A key success criterion has been the ability to plan nursing system in the context of the overall development of patient services within a hospital. So, what is the nurses information system? Nurses information system is a part of healthcare information system that deal with nursing aspects, particularly the maintenance of the nursing record. As nursing information system is a part of healthcare and hospital information system, the different strategies and approaches for designing and developing hospital information system followed from the decade of 1970 until the recent decade of 1990 are presented. So, nursing information system are defined as computer-based system that realize the measurement and evaluation of nursing process and the processing and management of nursing data and provide the application of information and communication technologies in nursing related field and procedures. So nurses can provide individualized nursing care by using information and fulfill their function like training and consultancy more healthily, which makes significant contributions to occupational professionalism by improving nursing care quality and patient safety. Uh, the three main approaches followed were the centralized approach, the departmental approach, and the distributed approach. The implementation and upgrading of nursing information systems follows some specific phases. These steps include planning phase, analysis phase, design phase, development phase, implementation phase, and upgraded phase. So, nursing information systems is used in three fields as, um, in general, clinical practices, management services, and training research. Nursing information system is used in evaluating and following the patient, defining the aspect of diseases concerning nursing, preparing care plans, providing and evaluating care, and sharing information with other healthcare professionals in the field of clinical practices. However, in the field of management services, on the other hand, nursing information system enables budgeting, preparing shift schedules, controlling and inspecting the personnel, measuring the productivity, forming statistics, and making the performance evaluation. While in the field of education, nursing information system is used in preparing, applying, and evaluating the curriculums. This table show the usage areas of nursing information systems in more details. The main functions that can be found in the current world's nursing information systems are care planning, such as nursing clinical records, care evaluation, discharge planning, workload assessment, prospective and retrospective, personal management, staff rostering, attendance recording, skill mix management, costing, budget management. These functions are typically grouped into three main modules: patient care module, workload assessment module, and rostering with associated personal and functionality module. There has been considerable variation in how hospitals have assessed their need for these modules. Some have concentrated on single modules, whilst others have looked for integrated solution containing element of all three modules. The current trend is toward integrated system, and suppliers have responded accordingly. However, the requirement to integrate nursing systems with other hospital systems has been less easily achieved. So there's demand for achieving the integration between nursing system and other hospital systems, such as ward ordering, result reporting, stores functions and stock control, patient administration, that's related to the admission, discharge, appointments, and analysis of patient satisfaction, complaints, and accidents, and the ability to receive and transfer patient information between organizations, electronic health exchange, which we call it sometimes, for example, between hospital and community. Nursing information system has various benefits for healthcare professionals. Nursing information systems allows a rapid access to the data required for healthcare and solves the clinical problems of patients rapidly and efficiently. Additionally, the records are used by healthcare team as a means of communication, education, and also identification, investigation, legal document inspection, and control. Nurse documentation system, nurse decision support system, patient follow-up and observation system, reminder, warning devices, and calling system. All of these involved within the scope of nursing information system that accordingly increase the patient security, patient satisfaction, healthcare and healthcare services quality, and data usability, providers early diagnosis and treatment, and decrease clinical errors and the cost of healthcare services. Radiology information system is another, in addition on what we are mentioned before, component of health information system or the hospital information system. What is the radiology information systems? As we know, running a successful radiology practice requires a great deal of time and attention with so many moving parts to keep track of. And practices that rely on an antiquated paper-based system to organize their work and maintain files on patients are at a distinct disadvantage when compared to competitive radiology practices that have included modern technology in the form of radiology information systems. Radiology information system is a sophisticated database system that uh, radiology medical professionals use to keep track of patients' data and the enormous image files typically generated in the course of diagnosis and treatment. So, a radiology information system is a special kind of electronic health records system designed specifically for use in radiology, and you use it to manipulate as well as distribute patient data. Okay. So, a radiology information system is defined as a technology solution to complete computerization and modernization of the work of radiology center and transition from film to paper and full electronic management and digital recording. The radiology information system creates the digital radiology center where information is always available at the right place and at the right time. Uh, Within the realization of radiology information system, it is necessary to follow the standards and systems relating to the specific radiology information systems, which are digital imaging and communication in medicine, picture archiving and communication systems, health level 7, and the relevant link of modern radiology information system are teleradiology and mobile radiology. Radiology information system require a developed infrastructure network, hardware or software. Why the development radiology information system need these infrastructure? The reason for this lies in the fact that the radiology represents a pictorial branch of medicines that radiology use images in daily work, that radiological images are in a digital form, that radiological image as file contain a large number of data, that X-ray machines are digitized, that examination by computed tomography CT, magnetic resonance imaging, mammography, ultrasound, digital X-ray machine, and other radiological imaging devices give radiological imaging in digital format of 1 to 600 megabytes, sometimes over 600 megabytes, which is too big. So they need specific hardware and software. Uh, the development of information system in healthcare is approaching the process of integration various systems used in a single computer. So that we witness today the general idea of merging the functions of clinical hospital information system and radiology information system. As we can see in the figure, with a radiology information system in place, you have the ability to integrate multiple functions into one comprehensive system, eliminating redundant actions while boosting your staff's efficiency with easier access to crucial data. From registration and scheduling to billing and reporting on results, the radiology information system streamlines operations as your staff can help more patients. The workflow cycle begins with physician order entry, usually using the hospital information system or electronic medical record. Then data necessary to support imaging workflow are communicated to radiology departments via the radiology information system. The picture archiving and communication systems then organizes medical images for review by a radiologist or other healthcare providers, as well as long-term storage. The technical standards involving the organization and communication of these systems will be discussed. The breadth of imaging informatics covers practically all aspects of radiology. In one sense, every part of radiologist reporting workflow outside of image interpretation involves informatics. So the implementation of radiology information systems. Implementing a radiology information systems will help your healthcare providers work more accurately, leading to fewer medical errors and transcription mistakes in charts, while helping you develop more salient diagnoses. Radiology information systems are also crucial for coordinating care across services boundaries, such as when you send updates from your imaging department to the patient's primary healthcare provider. For example, according to the Crow and Sim 2004 study, after implementing of radiology information systems and picture archiving communication system, found that the radiology information system has been helpful in clinical decision making, and patient management has been improved, and the time taken to arrive at a clinical decision has been reduced, particularly in neurosurgery. The radiology information system picture archiving communication system has significantly improving access to imaging resources for teaching, owing to the ability to retrieve reference images and to project high quality images during teaching sessions. It has influence in improving communication with referring doctors. How? Radiology information system can integrate with referring doctors' electronic health system to allow you to access patient information without a fuss. Referring doctors who have easy, pleasant experience with sending patients to you are much more likely to do so again. And it's improved efficiency by finding reports, inputting data, and creating forms all become much easier when you have a home page to start from. Digitized information is word easier to search, sift through, and reference than paper records. Laboratory information systems is another component of medical information system in addition to what we mentioned before also. Laboratories perform tests that include all types of cell counts, analytical chemistry, drug and toxin screening, and detection of microbes. The result of these tests are important to biosurveillance of virtually every conceivable biological agent. Not only are the result of laboratory tests of value to biosurveillance, but so may be the mere fact that a particular test was ordered. The type of test order provides a clue to the clinical diagnostic thinking about the nature of the illness in a patient, and it may be available well in advance of the results of the test, possibly within minutes or hours of physician first seeing a patient. Therefore, the laboratory information system receives and stores requests for tests, and results are entered by laboratory technician or directly from laboratory instrument. And these results of tests are available via paper reports and electronic interfaces, both to human users and other information systems, such as clinical information system, pharmacy information systems, and so on. So the laboratory information systems has a significant role in improving the patient safety and healthcare quality. So what is the laboratory information system? Laboratory information system are computerized system for rich sources of data that could be used for numerous purposes, including operations, quality projects, and research. They foster accuracy and accessibility to the flow of samples and data in clinical laboratories. So by using the laboratories information systems, physicians may easily track each step in the testing process, from the administration of tests to the receipt of test results, which support timely decision making and diagnosis. Laboratory information systems is significant to enable bidirectional interfaces between laboratory information system and other information systems such as electronic health records, clinical information system, to ensure a seamless flow of information ranging from test ordering to result storing of clinical decision support. The integration of laboratory information system with other systems is always challenging because of large hospital networks, technological complexity, interface design, and the multitude of clinical and laboratory workflows. Other challenge observed in implementing interfaces between laboratory information systems and electronic health records are the selection and harmonization of test codes, the communication with electronic health records providers, fluid orders and collection, problems with displaying laboratory results, and the risk of missing abnormal flags, ordering specimens for anatomic pathology, and unanticipated change to laboratory workflows. The rules of laboratory information systems. The electronic health records are principal method of storing patient health data. And as the laboratory information system, a portion of the electronic health records, and they are the main avenue of laboratory staff to store data and provide laboratory results to healthcare providers. Electronic health records are now the principal mode of storing patient health information for diagnostic purposes and for scheduling and billing, among other functions. This type of technology allows physicians to enter the necessary data, leading to diagnosis and treatment, as well as provide documentation for review by outside agencies when necessary. So the electronic health records also often patients easy access to their own medical records. A fundamental portion of electronic health record is the laboratory information system software intended to assist in the workflow management of patient laboratory data. The foundation of laboratory information technology began with laboratory test automation. As manual testing was replaced by more productive automation, computerization followed. It's estimated that 60 to 70% of information leading to diagnosis is laboratory related, justifying the need for an laboratory information system to seamlessly interface with electronic health record software. Sorry. Okay. The last information systems in our lecture today is the pharmacy information systems. Sorry. In recent years, the advancement of pharmacy information system has been gaining attention due to the reduction of clinical errors with intelligent warning, message and rejection notices about medications. Furthermore, pharmacy information systems have been playing a vital role in preventing dosage errors by providing an individual dosage limit according to patient age, gender, and other factors. Most importantly, pharmacy information systems help to monitor drug-to-drug interaction, drug allergies, and various drug-related complications. So, according to this significance of pharmacy information systems in healthcare quality and patient safety, what is the pharmacy information system? Definition. The pharmacy information system defined as a system that supports the distribution and management of drugs, identifying the type of intervention, determining the amount of inventory, reporting and managing of cost, and improving the accessibility of information. The core function of pharmacy information system is outpatient and inpatient order entry, dispensing and purchasing management, and pharmacy stock. Other activities such as reporting, clinical monitoring, interventions management, administrating drugs, connection with other systems, transferring information, and financial statement management should be also supported by pharmacy information systems. The pharmacy information systems help clinical decision making by alerting users about clinically important drug-to-drug interaction, drug allergies, and drug doses. It also evaluates patterns of drug use as well as other possible side effects of drugs. The pharmacy information system may operate as a separate and individual system or as a part of a hospital information system paired with a computerized physician order entry system. According to a study conducted by Mahali, he's reported that the integration of computerized provider order entry and a pharmacy information system has nearly eliminated the need for pharmacy staff to re-enter medication orders from the computerized physician order entry system, and which has a significant impact in reducing the time and improving patient safety and healthcare quality. Accordingly, to ensure efficiency and effectiveness of these systems, evaluation of the pharmacy information systems is extremely important. This system could ultimately influence the safety and quality of care. So, what's the role of pharmacy information system in improving the patient safety and healthcare quality also? So the Institute of Medicine brought national attention to the concerns of patient safety with its report, Cure is a Human, 1999. The report claimed that more than 1 million people in the United States suffer from preventable medical injuries each year, and as many as 98,000 people die annually in hospital as a result of medical errors. Medication errors and adverse drug events continue to be the single largest source of the healthcare misshape. So actually, this report, To Err is a Human, has shed the light on a significant point in healthcare delivery, which is the patient safety. The report seized public awareness about patient safety by describing the mortality from medical errors in the United States as equivalent of the cost of one jumbo jet per day, which is tremendous. According to this report, it's estimated that 29 billion was invested in rectifying errors and adverse events resulting from healthcare provision. And that's tremendous also. So most of these errors, as I mentioned, is medication errors and adverse drug events. Okay, so the pharmacy information system has a significant role in reducing these errors and reducing the cost of these errors on the government expenditures, and also improving patient safety with healthcare quality. Medication prescribing errors are considered as the most common cause of actual and potential adverse drug events. For example, in the pediatrics, incorrect dosing has been shown to be the most commonly reported error, including computation errors of dosage and dosing intervals. The pharmacy information system has a significant role in improving this situation. Okay. And electronic pharmacy system have been endorsed by a number of prominent organizations, including the Institute of Medicine, the Institute for Safe Medical Practice, and the American Academy of Pediatrics as a means of reducing medication errors and improve patient safety. Increased job efficiency was identified as the second most important implementation goal by decreasing medication turnaround time and decreasing administrative paperwork and update information technology system. And finally, improving the existing hospital information system was the only other major goal of the pharmacy system. Okay, this is the end of our lecture, and these are the references that I have used in this lecture. Uh, thank you for your listening. This is the end of our lecture today, and I hope you find it nice, simple, and interesting. Uh, our next lecture will be about electronic health record implementation. We are going to explore the importance of explore and understand the importance of electronic health records and health information systems, and an overview of electronic health records implementation requirements. So thanks again, and bye for now.